Hey there, welcome back to the channel. Before I jump into what I'm about to share with you, I need you to do me a favor. If you've ever wondered why you can't sleep through the night, why you wake up at 3 in the morning and just can't fall back asleep, why you're tossing and turning, or why you wake up feeling like you didn't get any rest at all, even though you were in bed for 8 hours, this video is going to blow your mind. Because what I'm about to reveal to you is something that most doctors won't tell you. Something that the conventional sleep medicine industry doesn't really want you to know about, and something that I started researching after I noticed that my colleagues, the doctors I work with, were taking something very specific before they went to bed. And it wasn't melatonin, it wasn't valerian root, it wasn't any of the typical sleep supplements you see online. It was something completely different. And once I figured out what it was and why they were taking it, everything changed for me. So if you're curious about what that vitamin is and why doctors are quietly taking it to improve their sleep quality, stick around because we're going to dive deep into this today. I'm Dr. Rena, and on this channel we talk about the things that actually matter for your health. We don't do clickbait, we don't do pseudoscience. We base everything on research, on clinical experience, and on what I've seen work in real life. And today we're talking about something that transformed my sleep in just 2 weeks. So let's get into it. The thing that really got me started on this journey was a conversation I had about 6 months ago. I was working late in the hospital and I was grabbing coffee with one of my attending physicians. We were talking about how exhausted we both were, and I made a comment about how I wished I could sleep better, and this doctor, who I respect tremendously, looked at me and said something that stuck with me. He said most of the sleep problems people have aren't actually about sleep itself. They're about mineral deficiencies. They're about your body not being able to relax because it doesn't have the nutrients it needs to actually relax. And then he told me he takes magnesium glycinate every single night before bed. Now I know what you're probably thinking. Magnesium isn't exactly a sexy supplement. You've probably heard about it. You might have even tried it. But here's the thing. Most people are taking it completely wrong at the completely wrong dose, and they're taking the wrong form of magnesium, and that's why they don't see results. So let me explain what's happening in your body when you're trying to sleep. Your nervous system has 2 main modes. You've probably heard about this before. The sympathetic nervous system, which is your fight or flight mode, the mode where your heart rate goes up, your stress hormones spike, and you're ready for action. And then there's the parasympathetic nervous system, your rest and digest mode, where your heart rate comes down, your breathing slows, your muscles relax, and your body can actually repair itself and recover. Now the problem is that most of us are spending way too much time in that sympathetic mode. We're stressed, we're overstimulated, we're looking at screens right up until we go to bed. Our cortisol levels stay elevated. And what magnesium does is it helps activate that parasympathetic nervous system. It literally helps flip the switch from fight or flight to rest and digest. But it's not just about the nervous system. Magnesium is involved in over 300 enzymatic reactions in your body. 300. It's involved in muscle relaxation. It's involved in protein synthesis. It's involved in glucose control. It's involved in the synthesis of serotonin, which is your happiness neurotransmitter, and it's involved in the synthesis of melatonin, which is your sleep hormone. So when you don't have enough magnesium, your body literally can't do these things properly. Your muscles stay tense, your nervous system stays activated, your mood suffers, and your sleep falls apart. Now here's where most people get it wrong. They go to the store, they see a magnesium supplement, they buy it, they take it, and nothing happens, and then they think magnesium doesn't work. But the problem is that they're probably taking magnesium oxide or magnesium citrate, which are cheap forms of magnesium that your body actually has a really hard time absorbing. Magnesium oxide in particular is actually used as a laxative. That's its primary use. So if you're taking magnesium oxide and all you're noticing is loose stools, well, congratulations, the magnesium is working, just not for sleep. It's working as a laxative. The form of magnesium that doctors like my colleague are taking is magnesium glycinate. This is magnesium bound to the amino acid glycine, and this matters because glycine itself has sleep-promoting properties. Glycine helps reduce core body temperature, which is necessary for good sleep. Glycine also activates the parasympathetic nervous system. So when you take magnesium glycinate, you're getting the magnesium benefits, and you're also getting the added benefits of glycine. It's like getting 2 sleep supplements in one. Plus, because the magnesium is bound to glycine, your body absorbs it much more efficiently than it does with other forms. You're actually getting the magnesium where it needs to go instead of just getting laxative effects. There's also magnesium threonate, which is a form that crosses the blood-brain barrier. This form is particularly good if you have brain fog or if you have anxiety that's keeping you up at night. But if you're just looking for better sleep, magnesium glycinate is the way to go. There's also magnesium malate, which is good for muscle pain and recovery, and magnesium taurate, which is good for heart health. But again, for sleep, glycinate is king. Now, let me tell you what the research actually says about magnesium and sleep. There have been dozens of studies on this, and the results are pretty consistent. A study published in the journal Sleep Health in 2017 found that people with low magnesium levels are significantly more likely to have sleep disturbances. Another study, this one from 2012, found that magnesium supplementation improved sleep quality in older adults who had insomnia. These weren't people taking tiny doses, they were taking meaningful doses, usually between 300 and 500 milligrams per day, and what they found was that it took about 2 weeks for the effects to kick in. You don't take magnesium one night and sleep amazingly. You need to take it consistently for about 2 weeks before your nervous system adapts and before you really start noticing the difference. And here's something else that's really important. Most of us are actually deficient in magnesium. The recommended daily intake is 420 milligrams for men and 320 milligrams for women. But the average American is only getting about 200 to 250 milligrams per day from food. We're getting about 50% of what we need. And when you consider that stress depletes magnesium, that caffeine depletes magnesium, that intense exercise depletes magnesium, and that many of us are doing all 3 of these things on a daily basis, it's no wonder we can't sleep. We're magnesium depleted. Now, you might be wondering, if this is so important, why isn't my doctor telling me about this? Why doesn't my doctor recommend magnesium? And the answer is kind of frustrating, but it's important to understand. Magnesium supplementation isn't very profitable. It's cheap. You can get a good quality magnesium glycinate supplement for $15 or $20, and it'll last you a month. Pharmaceutical companies can't make money on magnesium. They make money on sleep medications, on prescription drugs. So there's no financial incentive for Big Pharma to promote magnesium. Plus, doctors are trained to think about nutrition and supplementation as kind of secondary to medication. And honestly, most doctors get very little training in nutrition. It's just not part of their medical education in any meaningful way. So they don't think to recommend it. But here's what I think is really interesting. If you go and talk to functional medicine doctors, naturopathic doctors, integrative medicine doctors, they're all recommending magnesium. They're all talking about it because they actually have time to think about nutrition and lifestyle and prevention. They're not just thinking about what drug to prescribe, they're thinking about how to actually help their patients feel better from the inside out. I want to tell you about my own experience with this. Before I started taking magnesium glycinate consistently, I was sleeping maybe 5.5 to 6 hours a night. I'd fall asleep fine, but I'd wake up in the middle of the night. I'd be up for an hour, sometimes 2 hours, just lying there, thinking about work, thinking about cases, thinking about whatever. My mind was racing, and then I'd finally fall back asleep, and then I'd wake up in the morning, and I'd feel like I hadn't actually slept at all. This was going on for years. I tried everything. I tried meditation. I tried better sleep hygiene. I tried dimming my lights in the evening. I tried melatonin. I tried valerian. Nothing really worked. And then I started taking magnesium glycinate. I took 300 milligrams about an hour before bed, and the first week nothing really happened. I was like, okay, this is probably another supplement that doesn't work, but my colleague had told me to give it 2 weeks. So I stuck with it. And then right around day 10 or 11, something changed. I fell asleep just as easily as I normally did, but this time I didn't wake up in the middle of the night. I slept all the way through, and I woke up feeling rested, not like I'd just been lying in bed for 8 hours, but actually rested, like my body had actually recovered. And this kept happening, night after night. I was sleeping through the night. My sleep quality improved dramatically, and after about a month I realized I wasn't just sleeping better, I was also less anxious during the day. I was more patient with people, my mood was better, my energy was more stable. Now, I want to be honest with you. Magnesium isn't a miracle cure. If you're severely sleep deprived, if you have a sleep disorder, if you're dealing with trauma, magnesium alone might not be enough. You might need professional help. You might need to work with a sleep specialist or a therapist. But if you're dealing with the kind of sleep problem that most of us are dealing with, where you fall asleep fine but you wake up in the middle of the night, or where you have trouble falling asleep because your mind is racing, or where you wake up in the morning feeling unrefreshed, magnesium can absolutely help. In many cases, it can completely solve the problem. Let me talk about some of the other reasons why doctors are so interested in magnesium right now. One of the biggest reasons is that magnesium is directly involved in blood pressure regulation. If you have high blood pressure, you probably have a magnesium deficiency. And if you take magnesium, your blood pressure often comes down. Another reason is bone health. Magnesium is essential for bone formation and for bone density. If you don't have enough magnesium, you're at higher risk for osteoporosis. Another huge one is metabolic health and glucose control. Magnesium is involved in insulin sensitivity. If you're trying to lose weight, if you have metabolic syndrome, if you're dealing with diabetes, magnesium is really important. And then there's the cardiovascular system. Magnesium helps prevent arrhythmias. It helps with heart health in general. But for tonight's purposes, we're talking about sleep. And what I want to emphasize is that magnesium is particularly important as we get older. There's actually a correlation between age and magnesium deficiency. As we get older, we tend to absorb fewer minerals. We tend to eat less mineral-rich food, and we tend to excrete more minerals in our urine. So if you're over 40, your magnesium status is something you really should be paying attention to. Now let me give you some practical advice on how to actually use magnesium for sleep. First dose. The effective dose for sleep is typically between 250 and 500 milligrams, taken about 1 to 2 hours before bed. You don't want to take it right before bed because it needs time to work. You want to take it after dinner, maybe as you're winding down, so that by the time you're actually getting into bed, it's already started to work. Second form. As I mentioned, magnesium glycinate is the best form for sleep. You want to look for supplements that say magnesium glycinate on the label. Third, consistency. You need to take it every single night. It builds up in your system. It's not like a sleeping pill where you take it and it works immediately. You need to be consistent for at least 2 weeks before you judge whether it's working or not. Fourth, absorption. Magnesium is absorbed better when you have adequate calcium intake. So if you're not eating dairy or if you're not supplementing with calcium, you might want to consider that. Also, your gut health matters. If you have poor gut health, you might not absorb magnesium as well. So if you're taking magnesium and it's not helping, you might want to think about whether your gut needs some healing. Fifth, interaction with other things. Magnesium can interact with certain medications. If you're on antibiotics, if you're on bisphosphonates for bone health, if you're on blood pressure medications, you want to talk to your doctor about timing. Usually you need to space them out by a few hours. But definitely check with your doctor if you're on any medications. Sixth, quality matters. Get a magnesium supplement from a reputable company. Look for third-party testing. Look for NSF certified or USP verified on the label. This means the product has actually been tested to verify that it contains what it says it contains. There are a lot of supplements out there that don't actually have the amount of magnesium that they claim to have. So quality really matters. Now, I want to address some of the common misconceptions about magnesium. The first is that magnesium will make you groggy in the morning. This is probably the biggest misconception. If magnesium is making you groggy in the morning, you're probably taking too much. Back off the dose, try 200 milligrams instead of 400, or you might be taking it too close to bedtime. If you take it right before bed, it might still be affecting you in the morning. Try taking it 2 or 3 hours before bed instead. But in general, magnesium doesn't cause grogginess. If anything, because you're sleeping better, you should wake up less groggy. The second misconception is that magnesium is only for people who have sleep problems. This is wrong. Everyone can benefit from magnesium. Even people who think they sleep fine probably have a magnesium deficiency that's affecting their overall health. The third misconception is that magnesium is the only thing you need for good sleep. This is also wrong. Sleep is multifactorial. You need good sleep hygiene. You need to manage stress. You need to get sunlight in the morning. You need to avoid screens before bed. You need a cool, dark sleeping environment. You need consistency in your sleep schedule. Magnesium is one piece of the puzzle, but it's not the entire puzzle. Let me talk about something that I find really interesting, which is why this vitamin isn't talked about more. There's something called the medical-industrial complex. Basically, the healthcare system is set up in a way that promotes pharmaceutical interventions over nutritional interventions. Pharmaceutical companies spend billions of dollars on marketing. They fund medical education. They fund research. They have tons of influence over what doctors are taught and what doctors recommend. In contrast, there's very little money in promoting magnesium. It's cheap, it's not patentable, so there's no financial incentive for anyone to really push it. But here's what's interesting. The doctors who know about magnesium, the ones who read the research, the ones who actually pay attention to nutrition, they're all taking it. They know how important it is. They know that it works. And more, the research is backing this up. There are now hundreds of studies showing that magnesium improves sleep quality, reduces anxiety, improves mood, and has numerous other health benefits. I also want to mention something that Barbara O'Neill, who is an Australian naturopath and nutritionist, has been talking about for years. She's been advocating for magnesium as a foundational nutrient for health, and while she uses a broader approach to health that includes diet, lifestyle, and multiple nutrients, magnesium is always at the core of what she recommends. And I think she's absolutely right. Magnesium is foundational. It's one of those nutrients that if you're deficient in it, everything else suffers. Your sleep suffers, your mood suffers, your energy suffers, your metabolism suffers, and if you're getting enough magnesium, everything gets better. So let me wrap up with some action steps for you. If you want to improve your sleep starting tonight, here's what I recommend. First, assess your current magnesium status. Think about whether you're eating magnesium-rich foods. Dark leafy greens are full of magnesium. Nuts and seeds are full of magnesium. Legumes are full of magnesium. Fish is full of magnesium. If you're not eating these foods regularly, you're probably deficient. Second, choose a good quality magnesium glycinate supplement. Do the research, look for reputable brands. I'm partial to brands like Pure Encapsulations, Thorne, and bulk supplements, but there are others that are good too. Third, start with a dose of 200 to 300 milligrams, taken about an hour before bed. Don't start with 500 milligrams. Start lower and work your way up if needed. Fourth, take it consistently for at least 2 weeks. Don't judge whether it's working after one night. Give your body time to adapt. Fifth, assess your sleep. Keep a little sleep journal. How are you falling asleep? Are you waking up in the middle of the night? How do you feel in the morning? Track these things so you can actually see the improvement. And here's something else that I really recommend. While you're starting the magnesium, also improve your sleep hygiene. Go to bed at the same time every night. Wake up at the same time every morning. Keep your bedroom cool, dark, and quiet. Avoid screens for at least an hour before bed. Don't eat a big meal close to bedtime. Don't drink caffeine after 2 p.m. Don't drink alcohol close to bedtime because even though alcohol might help you fall asleep, it damages your sleep architecture and prevents deep restorative sleep. Do these things in combination with the magnesium and I promise you your sleep is going to improve dramatically. I also want to say that sleep is one of the most important things you can do for your health. It's not a luxury, it's not something that's optional. Sleep is when your body repairs itself, it's when your immune system consolidates memories, it's when your brain is clearing out toxins. If you're not sleeping well, everything suffers. Your immune system is compromised, your metabolism is messed up, your mood suffers, your cognitive function suffers, you're more prone to disease. Sleep is foundational to health, and if magnesium is what's standing between you and good sleep, well, that's a pretty easy fix. So to recap for those of you who might have just skipped to the end, magnesium, specifically magnesium glycinate, is what doctors are quietly taking before bed to improve their sleep. It works by activating the parasympathetic nervous system by supporting muscle relaxation and by helping your body produce the neurotransmitters and hormones needed for sleep. Most of us are deficient in magnesium because of stress, caffeine consumption, exercise, and not eating enough magnesium-rich foods. By supplementing with magnesium glycinate at a dose of 200 to 500 milligrams per night, taken consistently for at least 2 weeks, most people see a dramatic improvement in sleep quality. It's not a miracle cure if you have serious sleep disorders, but for the average person who's waking up in the middle of the night or having trouble falling asleep, it absolutely works. Before you go, I want to ask you a favor. If this video was helpful, if you learned something that you're going to try, please hit that like button. It helps the algorithm. It tells YouTube that this content is valuable. And if you haven't subscribed to this channel yet, please do. We upload new content about health, fitness, nutrition, and the things that actually matter for your well-being every single week. And if you have questions about magnesium, if you want to know more about sleep, if there's another health topic you want me to cover, leave a comment down below. I read all the comments and your feedback helps me create content that's actually useful to you. One more thing I want to say before we wrap up. If you're taking medications, if you have any health conditions, please talk to your doctor before you start supplementing with magnesium. I'm not saying magnesium is dangerous. It's not, but it does interact with certain medications, and your doctor needs to know what you're taking. So just have a conversation with them. Tell them you're thinking about trying magnesium for sleep. Most doctors are actually supportive of this, even if they didn't think to recommend it themselves. Alright, that's what I have for you today. Thanks for watching. I'll see you in the next video. Remember, health is not a destination. It's a journey. So take care of yourself, prioritize your sleep, and I'll talk to you soon.